This meeting is being recorded.
Good evening and welcome to the Maryland Women's Heritage Center. We are thrilled that you're here to share this time with us tonight. I'm Kate Campbell Stevenson. I'm president of the board of Maryland Women's Heritage Center. And with our center, our goal has always been for the last 20 years, adding her story to history to tell our story. It is now my honor to introduce Kaylin Thomas, who is our Vice President of Communications for the Center, and she will be our moderator for tonight's event. So, take away.
Thank you, Kate. Thanks, everybody, for joining us tonight for Women and Caregiving 2, Research, Resources, and Respite. Tonight's conversation is in honor of National Family Caregivers Month. And according to the Family Caregiver Alliance, women provide the majority of informal care to spouses, parents, in-laws, friends, and neighbors. And their duties include hands-on health provider, care manager, friend, companion, surrogate decision maker, advocate, and so much more. In fact, the value of the informal care that women provide ranges from $148 billion to $188 billion per year. To help me with tonight's conversation is Donita Michelle Brown, who is the founder and CEO of the Benti Circle and Hey Caregiver. While serving in the Peace Corps in Africa, Donita's life took a pivotal turn when she had to return to the U.S. and become caregiver to her mother after her mom's brain surgery. Struggling to find relevant resources as a Black woman, she was driven to establish a supportive community she so desperately needed. The Benti Circle is for Black daughter caregivers. The certified caregiving consultant, educator, and facilitator is now a caregiver for both parents. And for full disclosure, I am a member of the Benti Circle. So welcome, Donita.
Thank you for having me.
Nicole DeGilio, caregiver specialist with the Caregiver Support Program at the Baltimore County Department of Aging. Nicole's role is focused on community outreach and education for caregivers. The program supports informal family caregivers with assistance gaining access to services, one-on-one consultations, and financial assistance for eligible caregivers. Nicole believes that caregivers are a vital part of our communities and appreciates any opportunity to highlight resources that can support them in their role. Welcome, Nicole. Next, we have Jennifer Fenton. She is the program manager, and I'll ask everyone to please mute yourselves.
Uses your pressure points in a way no other.
Thank you. Jennifer is the program manager of the Cognitive and Caregiver Resource Center at Keswick, a not-for-profit aging services organization in Baltimore City, whose mission is to improve the experience of aging together. She leads the Cognitive and Caregiver Resource Center, where she supports individuals living with dementia and their care partners through education, guidance, and connection to community resources. Her work helps families navigate cognitive change with understanding, confidence, and compassion. And we welcome you, Jennifer. Last but not least, we have Eileen Rosenthal, the program director for the Alzheimer's Association of Greater Maryland chapter, where she provides leadership and strategic direction for the implementation, growth, and quality of association programs and services. Prior to joining the Alzheimer's Association, she served as the Deputy Secretary of the Maryland Department of Aging, where she led the administration and management of the department's programs and operations and contributed to the development of public policy in the areas of aging and long-term care reform. Welcome, Eileen. So now, ladies, just the panelists, I'm going to have you guys unmute yourselves, and we're going to start the conversation. The first thing I want to ask you all is, tell me a little bit about the research that you're doing through your organization that focuses on the challenges and or help for caregivers. And I'm going to start with you, Donita, because I know you are currently at Johns Hopkins as a PhD candidate, and you can tell me a little bit about the research that you're doing.
Yep. Thank you, Kaylin. I'm actually a doctor of public health. So it's a DRPH, so it's similar, but we have more practice,
Gotcha.
Not as much academics. So yes, actually, before I became a student at Johns Hopkins, we participated in community-based participatory research as community members. The Benti Circle did, and the research that we do is around Black daughter caregivers. So those that are typically overlooked, and our contributions are undervalued. And we know that the only way change happens is through results and data, data driven. So I am working to create evidence-based interventions that are culturally relevant for Black daughter caregivers. We've conducted research around yoga and journaling at our very first restorative retreat. And so we have results from that. And it's just amazing to see just the quantitative and the qualitative, where we get the demographics, we know who we're working with, but we also get the stories. And stories are so important because that's what people want to hear. That's what they resonate with. And so, as kind of a continuation of the yoga journaling workshop, we conducted a storytelling workshop, which basically, folks share what does storytelling mean to you? So not only telling our stories, but how does it affect you and how does it support your overall well-being as a family caregiver? Because we know that a lot of caregivers suffer in silence, unfortunately. And I'm so grateful that we're in a space now where people are transparent. We have social media that's picking up, where people are sharing their stories, where you get an opportunity to hear that you are not alone. So now we are actually conducting a study around music and how music supports not only the caregiver, but and in our cases, their parent that they're caring for. And we're partnering with Dr. Kendra Ray. She is a music therapist who developed an app that we will be working with her on to kind of test that app out to see if it works for us. And so the ultimate goal is to create spaces and supports that help us, live better. We know that with caregiving, we are a public health priority, and that our health is at risk with stress and depression and all of the things. So that's our goal, is to intervene in that regard, because this population is growing. We have over 63 million, I think was the last number, of family caregivers who are unpaid, who do not have resources. And so that is the goal of the Benti Circle, is to make sure that we're living better and healthier in order to care for our parents so that they may live better and healthier.
Excellent. I forgot to mention that I too was a caregiver for both of my parents, along with my two siblings. And I do know for a fact that music was wonderful for them. It really helped them tremendously, and it brought back memories for them. Both my parents were in the early stages of dementia, and music was very helpful to them. And I know that because it is something that research has been done on with Alzheimer's patients, I want to go to Eileen And Eileen, have you tell us a little bit of the type of research you all are doing?
Okay, well, I'm really proud to share that the Alzheimer's Association is the largest funder of research in this country behind the federal government. So a good chunk of the money we raise goes into research. And we currently have over $450 million worth of active and committed funding for over 1,200 projects all over the world. So not just the United States, but we also fund research in other countries. And a lot of our focus tends to be on the basic science, both molecular and cellular processes. We're trying really to understand better the causes of Alzheimer's disease, treatment development, early detection. It's more urgent than ever for people to be diagnosed sooner rather than later, especially as we're in this new era of treatment with new drugs and new drugs in the pipeline, and they will only work for people in the early stages. So getting that diagnosis early is extremely important. We're also looking very closely at risk reduction and brain health. Some of you may be familiar with the US Pointer study that had its results released over the summer at a big international research conference where they had over 2,000 people who participated and agreed to follow certain protocols, both diet and exercise and cognitive stimulation. One group was structured and they had agreed to be adhere closely to the protocols. And then there was an unstructured group that was not committed to a specific number of minutes per week of exercise or diet, but they knew what the protocols were. And at the end of 2 years, and these were all people selected who did not have dementia, but were at high risk. Maybe they had high cholesterol or high blood pressure or family history or were over a certain age. Age is continuing to be the greatest risk factor. And at the end of 2 years, both groups came out as though they were a couple years younger than their biological age, which was absolutely extraordinary. And if we had time, I would play a clip from one participant, an African-American woman who, in the 2 years being in the structured study, she lost 30 pounds. She said her waist was 11 inches smaller. Her cholesterol, her blood sugar, and her blood pressure were normal. She was no longer in chronic pain. And she just couldn't say enough about how life-changing it was and how important it is to her to share this starting with her family, but really to get the word out to the larger community, because this is the key to lowering the high prevalence rates that we're seeing. So there is hope that there are factors that can modify someone's risk. And we also study care and support, quality of life. What are those kinds of interventions that make the most difference in the life of the person living with dementia, as well as their caregivers? So there's so much going on, and we're very excited to be playing a role in this.
What have you found when it comes to caregivers of people with Alzheimer's or dementia?
Well, obviously they need support. One of the biggest studies that really showed the importance of supporting the caregiver was the Mind at Home a few years ago that Hopkins was the lead on. And they surrounded the caregivers with a support team. So they had someone who was there with them and helped them. And they were given access to resources. And the goal was to see the impact it had on the quality of life of the caregiver and the person living with dementia, and they felt the outcome was very successful. In fact, some of you may have heard of the GUIDE model, which is a new program being piloted by CMS that has 4 provider organizations in Maryland participating, and those who are selected will have their own care management team, as well as up to $2,500 a year in respite funds. And some of this was driven by the results of some of these other studies that are showing that when you support the caregiver properly and you give them what they need, they're more likely to achieve their goals of being able to keep their loved one home.
Excellent. Thanks. Nicole, what kind of work is being done with the Baltimore County Department of Aging related to caregivers?
Yeah, so within the caregiver support program, a lot of our data that we're pulling and the research we're doing is really focused on what our caregivers need. So we do a lot of outreach throughout the year, events, things like that. And so we like to do a lot of just survey of needs following events like this to make sure that the events that we're conducting, the outreach that we're doing is really addressing the needs of the caregivers. So we frequently will do a survey of needs in order to just really hone in on the specific things that our caregivers are looking for. And that allows us to really tailor the events that we're doing and the information that we're providing in order to really address their specific needs.
And what are
So
some of those needs?
yeah, so oftentimes what we're finding is a lot of what folks are looking for are financial resources. And so that is something that we're always looking for ways that we can provide other avenues to financial resources for caregivers. There's also a lot of, and I think everyone on here can probably relate to this, there's a lot of reports of just feeling burned out and feeling stretched thin in their caregiving duties. We find that we have a lot of caregivers that are in that sandwich generation where they are both caring for an aging parent and caring for a child. And so looking at ways what can we do as our program within the Department of Aging to really address some of those burnout needs and make sure that both that sort of physical, emotional, financial, all those needs are getting addressed.
Absolutely. When we were caregiving, we also had homemaids come in every day for a few hours a day. And that was extremely expensive because that's something Medicare does not pay for. And so I know about the financial needs, and also burnout is very real. We had a lot of burnout. And there's so many caregivers out there who are burnt out and still going. And so that is very much needed. What about you, Jennifer? What type of research has been done with Keswick related to caregivers?
So some research that was really powerful to Keswick. I'm a proud Baltimore City resident of over 25 years. And a stat and some research that's very fascinated and maybe under reported, underknown, is that Baltimore City has the highest rate of dementia in the nation.
Whoa.
Right? Yeah, a lot of people don't realize
Wow.
that. It's actually tied with the Bronx, but
Oh my
16,
goodness.
yes, 16.6% of people 65 and over in my beautiful city of Baltimore have some sort of cognitive impairment or dementia. So that statistic was really staggering for us at Keswick. Keswick is a 141-year-old skilled nursing facility and aging services provider. A lot of people know Keswick as a nursing home, but we're a lot more. We have also community health. So what Keswick has done to support not only that huge population of older adults with cognitive impairment and dementia in our city, but also the caregivers, as we've been discussing, is to create our Cognitive and Caregiver Resource Center. And the things that we are kind of piggybacking on some of the other questions and what the fellow panel members have provided, the things that we're providing for those caregivers and those folks with cognitive impairment in our city, providing educational resources. So we've had a series with the Alzheimer's Association. We collaborate with Johns Hopkins. We collaborate with the Alzheimer's Association. We've collaborated with Baltimore City Health Department to make sure that we are providing education and resources for the caregivers and the healthcare providers who are supporting those people, as well as providing actual respite for the caregivers through our social engagement program, which is for folks who are higher functioning and independent with their activities of daily living, but need that you had mentioned the financial strain of having a home care aide come into the house. So providing an outlet for those folks to get out of the house, to have that socialization, to walk down to the farmer's market and prepare a meal for the caregivers. We do enjoy partnering with local small businesses and then preparing meals, sending that home to help support the caregiver, as well as giving them that 10 hours a week right now. We have 2 days a week, 10 hours a week to have that respite time. You had also mentioned self-care and caregiver burnout and how important that is. There's a great Lisa Gibbons book that says, put your own oxygen on first. A lot of times as caregivers, we're so focused, and it's intuitive for women as mothers, as nurturers, as sandwich generation members, to focus solely on the person who needs our care and our attention.
Right.
And so I love that analogy of putting your own oxygen on first. In an airplane, when they're going over the safety rules and they say, always put your own oxygen on first before you assist your child or someone that you're traveling with, which seems counterintuitive to us nurturing caregivers, us women. But if you suffer from the results of being deprived of oxygen, you and the person you're caring for are going to be at a loss. So it's really important to provide that self-care, to take care of your nutrition, your mental health, your emotional health. So at our Wise and Well program for folks who are 50 and over, we have personal trainers and exercise classes, Tai Chi, art, acupuncture. We have a variety of classes so that you can get the education that you need to provide that dementia care, but you can also take care of yourself and your soul and your heart and your mind and your physical body so that you're able to continue to provide that care that's such a strain on folks.
It's so true. I didn't really get it about putting my own oxygen mask on first until I actually started having health problems myself from the stress of caregiving. And so it is extremely important. Sometimes it's easier said than done, but it is extremely important to put your own oxygen mask on first. So we're going to go to the next question, which is to tell me a little bit about the resources that you provide for caregivers. And we'll start with Donita. Is she there?
She's muted.
Oh,
You're muted, Donita.
I'm muted. I am muted. I was saying that the Benti Circle provides what I call community care in motion for these women. We are a peer support network. First and foremost, we have a wildly live group chat on WhatsApp. So that's a resource in and of itself. There are women that have been wherever you are. We have all of our members are on, the full spectrum of caregiving, from just thinking about, like, I see some signs that I'm about to step into it, to I am on the other side. My parent has transitioned, but we still have that support within the circle. We also provide monthly support group meetings. We call them Feel Good Friday. We're all about feeling good. We want to make sure that this is an opportunity that you not only learn something, but you're able to fellowship and be with your fellow sister caregivers. We provide an all expense paid annual retreat, a restorative retreat. And again, participating in the research, we also have programming which actually informed my work around music called Respite with Rhythms, where we attend live music outings. And again, all of this is funded through grassroots fundraising. So, Eileen, when you said that big millions and millions of dollars that Alzheimer's Association has, I'm like, hey, how can we get a piece of that? But I am very I'm really grateful to share that we work hard to raise the funds that we need to provide the programming that we know work for us. And although we know it just based on, me being a Black daughter caregiver, I belong to the community that I serve. And so we know it, but again, the research is going to allow us to have proven data to show that what we're doing works. So we actually also do a lot of outreach in the community. I'm so happy. I see our community outreach specialist, Kathy, is on the call. She is amazing. We have been able to work and, really collaborate with some organizations around the city. And so we provide what I say holistic support, because we also provide respite scholarships for those that are caring for their loved ones. When we have Feel Good Friday or Respite with Rhythms, we know that it's going to cost you at least $150 just to come out. And so we provide scholarships so that you don't have to worry about that financial strain of figuring out, how am I going to pay for someone to care for my parent while I attend a retreat. And so we try to make sure that we take that burden off of you, because our goal at the Benti Circle, again, is to make sure that we are living our best lives, if you will, that we are healthy mind, body, and spirit. And to the point of putting your own oxygen mask on first, I live by this philosophy called self-full. And self-full is that sweet spot between selfish, which, family caregivers typically they feel guilty. They feel like, oh no, if I take time for myself, I'm taking time. I need to be here with mama or whatever. No. And then on the flip side is selfless. And I say selfless is reckless, because if you're caring for somebody else and you're not taking care of you, as you mentioned, Kaylin, you had your own health struggles, it will manifest itself in a way that is not beneficial, again, for you or the person you're caring for. And so I encourage caregivers and just people in general, and we're talking about women, we wear that superwoman schema all the time, and we want to
Yeah.
be, save everybody and always want to show up and don't want to tell people no, which is a complete sentence. I encourage everyone to be self-full, that sweet spot between selfish and selfless. Do not give too much of yourself, and do not neglect yourself. And so that's, those are what we provide within the Benti Circle. And I just know that we're growing. I mean, we have women in over 23 states and a woman that's in Colombia. So I'm happy to say that we're global. And again, we are doing this grassroots. All of our funding, for the most part, have come from the work of the women who are part of this circle.
Eileen,
Absolutely.
you asked for Bill to share your screen. You should be able to share your screen now if you want.
Okay, thank you.
So Eileen, you are about to tell us some of your resources?
Yes, so
Okay.
I appreciate being able to share the screen. Let me put this in slide format. Okay, so I hope everybody can see this, but
Yes.
but I also want to say, Donita, I'm happy to talk to you offline about how to look at opportunities to apply for research funding from the Alzheimer's Association.
Fantastic. Thank you.
So anyway, the most important thing I want everybody to remember, if you don't already know about it, is we have a 24/7 helpline. And you can call that number, 800-272-3900, 24 hours a day, and talk to a live clinician. And it can be a very simple call for the list of daycare, or do you have suggested activities I can use to kind of keep mom stimulated? Or it might be 3 a.m. and mom is exhibiting some behaviors that are scary because, as many of you know, often at the later stages, people may exhibit behavioral problems, psychiatric symptoms. And the last thing the daughter wants to do is call 911. It is traumatic enough for somebody who's cognitively healthy to have to go to the ER. And for someone who is not cognitively well, it's even more traumatic because they look around and everybody looks strange and they look like astronauts and everything's beeping and they're tied down, and their instinct is self-protection. So if someone comes near them, they might very well try to hit them. And so we would like to avoid unnecessary trips to the hospital. So people can call that line, and sometimes they'll call and say, Joe he's moaning and I don't know what's going on. And they'll try and walk them through it. Well, could he be in pain? Does he have to go to the bathroom? Is he hungry? Is he hot? Is he cold? And so they try and help figure it out. And they also try and guide the person on how to redirect them. And maybe they're thinking something that's sad. Maybe they're thinking about a loved one that died and it's upsetting them. And so the clinician can help the caregiver think about ways to redirect their attention to something more positive, or maybe play some music. I heard you talk about music before. So the helpline, we are a huge repository of information. So it could be for someone who was recently diagnosed, they need an elder law attorney because they don't have a will, they don't have advance directives, they don't have a power of attorney. And it's really important that these decisions are made while the person is able to contribute, because then you leave the family fighting with each other saying, well, dad would have wanted us to do this. And the daughter saying, no, he wouldn't. And dad didn't put it in writing, and all they can do is argue. So we could provide lists of specialists, elder law attorneys, assisted living facilities, daycare, and really often someone will describe a problem, and we have documents that people can even upload from our website on, dozens of topics, and the helpline also has way more than even the website has. So lots of really great information. We also are in the community all the time. We have over 50 support groups in the state of Maryland. Some are virtual, some are in person, some are specialty groups. We have a Spanish language group. We have a Korean language group. We have an early stage late onset group. We have a frontotemporal dementia group. We have an LGBTQ group. So if someone calls the helpline and they just want to find a support group, they'll ask them enough questions and figure out what might be the best match for them. We do lots of education. We have a list of nationally developed education programs that cover everything from the early warning signs that people often think are normal aging when it's something that should be part of a conversation with their healthcare provider. We even teach people about managing money. We talk about all the legal and financial decisions people be faced with. We help explain Alzheimer's and dementia and the different types and how they progress and what people should expect. We have a series called The Empowered Caregiver that really gets into a lot of specific caregiver topics like finding resources or communicating effectively or dealing with difficult behaviors. So we have a nice variety. And the biggest one that is in highest demand is something called Healthy Living for the Brain and Body. And it draws on the latest research and what we know about those modifiable lifestyle factors that could lower somebody's future risk for cognitive decline. We have some early stage programs like memory cafes, and we have really a wealth of online resources on our website. We have something called All's Connected, where someone could just go in, a caregiver can just go in and post a question, and before they know it, 4 people have answered and said, well, this is what I did. I had that same problem, and this is what helped me. And I have stories of people meeting other people through All's Connected. There's one person I know who was a caregiver for her husband, and she became connected to other women around the country, and they formed their own Facebook group and would talk to each other all the time. And one of them got remarried years after she lost her husband, and they all went to Texas for the wedding and got to meet each other for the first time in person. So the message is there's help out there. This is a really challenging journey, and we want people to know, because the worst thing I ever hear is when people say, oh, I wish I would have known. Oh, I could have used one of those support groups. And then the other exciting thing is we have a brand new free phone app. It's called My All's Journey, and you can download it from the Apple Store or Google Play. And it puts really great information at the fingertips of even someone who is in the early stages living with dementia can use the app and find information. And the caregiver can find lots of information, help them better understand the diagnosis, how to stay independent, how to plan for the future. And it connects them, with their local chapter and the resources available through the chapter, schedule of education programs. So it's a really great brand new app. And then the last thing I did want to mention is we have an annual conference for African American caregivers that's going to take place this Saturday at Morgan State University. And we're excited. The Benti Circle is going to be there as an exhibitor.
That's right.
And
Yes.
this has been going on for over 20 years, and it's very well received by the community because it gives caregivers a chance not only to get out and to have access to really important information, but to engage with other caregivers and to realize they're not alone on this journey. And so our keynote speaker, Dr. Ethlyn McQueen Gibson, is on the faculty at several universities in Virginia on the nursing faculty, and she is going to be talking about brain health and risk reduction as her keynote presentation. So we're probably going to close registration by the end of the day tomorrow. It is free. We provide breakfast and lunch, but more importantly, great information and great connections. So I'll try and pull the link and put it in the chat before we end tonight.
That would be great. Thank you. You have a wealth of resources, and so that's wonderful. And earlier you mentioned, not wanting to be in the ER. And so I have to do a shout out to my sister who's on the on the Zoom, because she was the go-to person whenever my parents had to go into the ER. She was the one who had the patience to sit in there with them for hours. So thank you, Kelly, for that. So how about you, Jennifer? I know you mentioned some things that you guys are doing at Keswick, but is there any other resources you want to mention?
I as a community health provider and aging services provider, I think that the education piece, and I think Donita had touched on it a little bit earlier, but pairing and balancing evidence-based research and educational series. Eileen had just mentioned the Empowered Caregivers series. So balancing the evidence-based and evidence-driven research and educational series, but also with the anecdotal, and I think that was something that you had mentioned, Kaylin, about telling stories and sharing. And so providing caregivers with that empathy and the tools that they need, and putting those tools in their toolkit to give them those resources when it's 3 a.m. and mom is awake and we don't understand why she's having these difficult and these challenging behaviors. You can say, oh, I learned in my evidence-based class about research and about tools and how I can manage these behaviors. Oh, and then Kaylin told me that great story about her and her sister in the emergency room. And so really balancing those two resources, I think, give people the mental strength to get through and the mental resources they need to get through it, as well as the emotional resources. And so having both coming from it holistically from both sides, I think is really important to give caregivers the tools that they need to get through some of these really difficult situations that they find themselves in constantly.
Absolutely. And I know that 3 a.m. is a serious
the witching hour. It's the witching hour.
I mean, that's the time that I want to call somebody and I think I can't. But thank God the Benti Circle has a WhatsApp thread, and you can get on there at any time of day and somebody's on there, and so you can just say, I'm about to fall off the ledge. So, yeah, absolutely. That is amazing to have that. Nicole, how about you and the resources that are provided?
Yeah, so I will preface with, in terms of the resources we provide, while they are specifically for Baltimore County, I do want to highlight the fact that our program is federally funded. And so while my specific program is for Baltimore County, it is replicated in every county in the country. And so if you are not necessarily a resident of Baltimore County, I highly encourage you to reach out to your local area agency on aging, because they do have a caregiver support program. How they operate, it might be slightly different than how we do, but certainly reach out because there is assistance available. So in terms of those resources we're able to provide, the caregiver support program can offer once a year financial assistance for caregivers. You can apply once a year and use that funding to sort of offset the costs of caregiving. So oftentimes, some caregivers will choose to use that to pay somebody to come in and give them a little bit of a break. You can also use it to pay for medical supplies or other things that you might need just to help support the person that you're caring for. We also have a couple of social workers on our team, and they can do phone consultations where they will sit and chat with you and just really kind of dive into your specific caregiving situation to see if there are other resources they can connect you to, or honestly, sometimes just to give you that chance to just speak it out loud, and just get those feelings out there, because sometimes it's just
Right.
to talk to somebody. So we
Exactly.
offer that as well. And then we do have events throughout the year as well. I will highlight that we have our our large annual event is actually this coming Friday at the Randallstown Community Center. So if anyone can make it out, it's totally free. It's going to be from 9:30 to 3. We're going to have resources. There's going to be breakfast. There'll be some support group sessions, some yoga sessions, just some different resources for caregivers. So I'm happy to send that flyer over after this if you guys want to share it. If anybody wants to come out and join us. So yeah, so that's kind of sort of the main resources that the Caregiver Support Program provides. And then the Department of Aging in general also has lots of resources. The senior centers in the county are thriving. They're really active, and I think they're a great resource for both caregivers and the people that they're caring for to come out, socialize, exercise, educate. There's lots of opportunities, so it's a great resource.
Absolutely. I am a member of the Randallstown Senior Center, and it is great. Absolutely great. And it was one of the things that helped me to release some of that stress coming to some of the classes there. Now, I know, Donita, you had spoken about the respite that you offer to members of the Benti Circle. Is there anything else you want to mention about your respite programs?
I would just say I feel like respite is at the core of what we do. Because when we think about respite, it's not just time off. It's a time to kind of get away from what you're doing, but also be in a space with life-minded women that get it. So you're seen, supported, and so with that, you feel like you can continue on. Like there is a level of restoration in the respite that we provide. I will say, along like with our fundraisers, we incorporate an element of respite to it. With our Care to Laugh, we recently just had our annual comedy show fundraiser. Not only were some women even brought their parents. So it's an opportunity again with respite is not just, time away, but it's a time to refill, replenish yourself. And I also will say, outside of what we provide for those that are caregivers that may not have a support, you can create respite in your home, in your mind. It doesn't have to be, you don't have to get away. You could create respite spaces wherever. I've created respite spaces in my home when I could not physically get away. And so that's one thing, too, that I really encourage other people to do. And
Give me an example of that.
like I I live in inner city Baltimore, have been here all of my life, so 50 plus years. And I created a space that even doesn't look like it belongs where it is, but I call it Dee's Oasis, a beautiful outdoor space that I can just go and retreat to. Well, now it's winter. I do have a fire pit, but it's been very, very cold. But whenever it's not, just creating a space, whatever you like to do. If you just want to doodle, if you like coloring, those types of things, create a corner somewhere in your home that's away from everybody else. Sometimes I go to the bathroom to retreat. And my mom's like, "You're not done yet." I'm like, "Listen, ma'am, listen, give me a break." But knowing that you have to establish boundaries, even with the person that you're caring for. My mom is bedbound, and really she can't do anything for herself, but I still establish my boundaries and put my foot down because I know that, again, if I don't take time for myself, I'm not going to be any good to her. So, but I'm just very proud to say that respite is at the core of what the Benti Circle does, and everything from our fundraising, from our activities, from just, our gatherings. Respite is at the core.
Absolutely. Just before I say the next thing, I want to let all of our participants know that they can type any questions they have in the chat so that Diana can read them off to us, and because we'll be coming up on the question and answer period in a minute. But I wanted to say that one of my little spaces for getting away was actually sitting in my car in the driveway after I came back from running errands, just sitting in the driveway just to get my nerves together to go back in the house if it was one of those crazy days, So you're right. You can take a little tiny respite anywhere. Nicole, so Nicole, you had mentioned I'm sorry, you already mentioned that, but Eileen, I know that you mentioned a couple of things for respite, but is there anything else you want to mention about respite for caregivers?
Just that it's always worth a phone call to our helpline because, again, as a large repository of information, we usually have lists of local respite resources that are available. And so they would know who to send you to at the local level. And more likely than not, they would say, don't forget to call your local office on aging or your local Department of Social Services. And if there's a local respite fund that's only applicable to one particular geographic area, they probably know about that and can direct people to that as well. And again, if people are caring for someone with dementia and they live within the geographic catchment area of the new guide model, we encourage all of them to consider applying to be in the guide model because that would also provide up to $2,500 a year in respite funding.
Awesome. Okay. And what about you, Jennifer, over at Keswick for respite?
Yes. Well, thinking about respite, thinking about time, thinking about spaces, but also thinking about other services. I'm very fortunate to have grown up. I'm 100% Sicilian. And whenever there's a crisis, whenever people are struggling, when a baby's born, when there's a death in the family, food. So meal preparation, housekeeping services. There are a variety of other, in addition to having that time to yourself, refilling your cup, thinking about what you could do, what you would want if you were struggling with in your caregiving role, and providing those additional services, providing resources and referrals for those services as well. So I think meal prep and housekeeping services, because when you're tired, we talk about brain health and nutrition and how important it is to keep your body strong while you're going through providing care. When you're tired and you can't bring yourself to cook a meal, having someone else prepare a meal for you can go a long way. Knowing that you have something frozen in the freezer, those are some things that we think about and are also good respite options to provide those kind of supplemental things that you might not think of initially when you think about respite services. There's something else that.
Absolutely. Nicole, was there anything else you wanted to add before we go to questions and answers?
I will just say that in addition to that respite funding that we are able to provide through our program, Maryland Access Point, which is sort of the main resource hub for the state, is a really great resource as well. Also through the Department of Aging, but it's a good starting point when anyone's looking for resources. because while our program just provides that one time a year assistance for respite, there are other programs like other folks have mentioned through Department of Human Services and other things. So Maryland Access Point is a great sort of starting point when looking for resources, including respite. And I'll put that phone number in the chat as well, so folks can have that.
Okay, great. So Diana, do we have any questions from the audience?
We do not as of yet, but now is the time, and there's two options here. One is that because we're a relatively small group, if you'd like to, just because that way I can manage it. If you have a question, if you want to either put it in the, oh, here's a question for Jennifer, but let me finish my thought. If you have a question, please put it in the chat box, or you can also raise your hand. But sometimes on this big screen, I can't always see everybody. So let's try with the chat box first, but let's start with Motorola, and I don't know who that is, but this is a question for Jennifer. Do you have any ideas as to why Baltimore has such a high rate of mental decline? That's very alarming. It is.
That is a phenomenal question. And it's something that I actually did a 6-hour dementia training for some of our clinicians, some of our nursing staff today. And that is one of the first things people are first shocked to hear about Baltimore's dementia rates. And then that's their next question. And I think that I've lived in Maryland my entire life. I've lived in Prince George's County. I've lived in Anne Arundel County. And there are, I think it's multifaceted is the kind of short answer. My daughter goes to Baltimore City Public Schools. She had to be tested for lead in her, she had to have tests done for lead. None of my friends who live in other counties have to have that testing done. Is it lead paint? Is it socioeconomic status? Is it access to healthcare services? We know that dementia affects women of color at a much higher rate than it affects men. And so looking at access to healthcare, looking at nutrition, food deserts, I mean, environmental status, environmental causes. There are a lot of different things, but I do think it's multifaceted. But that's a great question. And there are a lot of different opinions and different views on what causes that.
If I could jump in,
yes.
We have the biggest risk factor continues to be age. And we have large older adult population in Baltimore City. Prince George's County is also on the top 10 list. And so the large older adult population, but our rich diversity also contributes to the high prevalence, as Jen alluded to. This disease disproportionately affects people in communities of color at twice the rate as their white counterparts. And, when people say, well, why is that? And Jen mentioned some of the social determinants of health, lack of access to healthcare, lack of trust of their healthcare provider, lack of access. She mentioned food deserts. It's cheaper to buy fried chicken than fresh fruit in some neighborhoods where you don't have, a grocery store nearby. So we've got a historic history. We also have high rates of cardiovascular disease and diabetes. And guess what? We share the same risk factors. So if we could get the prevalence of dementia down, we would also see a huge win for public health across the board, because we'd see some of the other chronic conditions benefit as well. So we are in conversations on how to do this with our friends at the HBCUs and Baltimore City Health Department and the health systems. And I call it our version of the smoking cessation campaign, because we really believe we can get the prevalence down. So,
Eileen, I also spoke to a doctor who said that some doctors call Alzheimer's diabetes 3. And so, a lot of people who have dementia also have diabetes. And so, that's also an issue. I myself have diabetes, and my mother had diabetes. And so that's something that I really am working on to be sure it's under control, because that is a concern of mine. And I think that's a concern for a lot of caregivers who are caring for someone with dementia. They're worried that they're going to get it themselves, and that's something I really have a concern about.
Kelly, thank you very much for that question. It clearly opened up a lot of discussion for that. And Donita had a question. Do you have many men accessing these services?
There are men, but women tend to be disproportionately affected. Men probably die sooner from other chronic conditions. And as you heard earlier, women tend to be more likely to be the caregivers. But yes, we get calls all the time from women who are caring for their husbands.
And I'd like to add that we have a brother circle of men who are caring for their parents as well. But men are different in terms of, reaching out or asking for support or, so I'm working very hard to kind of encourage our brothers to again embrace the community and share your stories, because I feel like sharing your stories is where help and healing comes from. And so I do see more men sharing, let me say that, at least sharing, and so that's the first step.
Yeah,
And
personal
Donita, in
witness.
your,
Go ahead.
I'm
Sorry,
sorry.
Caitlin. Go ahead.
Oh, I was just going to say that for the Benti Circle's Care to Laugh fundraiser, the comedians were men who were caregivers.
Exactly. And it was hard just trying to kind of groom them and say, "Hey, listen, I want you to share your story." They were a little hesitant because they're comedians, they're comedians first. Where with women, and I've had for our fundraiser for our Care to Laugh, I've had female comedians who were caregivers. They were caregivers first, then comedians. With men, they were comedians first, then caregivers. So I was trying to let them know that our audience, we are an audience of caregivers and those that support them. So please, share your caregiving stories. And so men are just different. But as we continue to grow, like I say, with caregivers, and to your point, Eileen, people are living longer, and specifically in the Black community. And so the kids will be the ones to care. And so we need support. We need people to be transparent. We need people to own what we're doing and call it caregiving, because for so long this is what we did in our community and we didn't identify as caregivers. So now it's like, hey, we need to say, yes, we're a caregiver. We're not just a daughter, we're not just a son, but we are caregivers as well. And so to make sure that we get the resources and the support that we need.
In my
Absolutely.
family, my brother, my slightly older brother was the major caretaker for my mother, who is living alone after my dad passed away in a nursing home. And he was geographically, he was in Florida. I was in Maryland. I was still working in a state job, blah, blah, blah. So I would go down there probably every 6 weeks to give him a respite, and he'd go to the beach wherever he went. But I was beginning to see signs of wear and tear. So I found a community counseling group, somebody support, blah, blah, blah. Well, we met, nice people. He never went back because he thought he had it all together. Now, again, he had friends, but it took all that caregiving took a terrible toll on him. Now he's since passed away from cancer, but I to this day think that weakened his system. I don't know.
Yes,
But
I
he
agree.
was the major caretaker for a long time, and I couldn't help him help. It was anyway, it was a difficult story, but anyway. So there's a comment from Judy, and her parents are in the mid 80s and are independent living in a wonderful retirement community that does provide support and guaranteed step up plans for when they need them. My dad has moderate cognitive issues that are getting worse. Yeah, I'm sorry. They live in Wilmington, North Carolina, 10 hours away, and neither ask for any help easily. I travel to see them about every 3 months. So my questions, one, what do you suggest for those of us who aren't there yet with having to provide more support, but may soon be? And two, how can needed support relationships be formed with people and organizations like yours while so far away? Hope that makes sense.
Does anybody want to take that?
I have a thought. So I can't remember who it was. Someone on the panel had mentioned earlier advanced directives and making decisions, because I don't remember if that was you, Donita, or maybe it was Eileen. But my father passed away a year ago, and my grandparent and the conversation with my grandparents about life support, advanced directives, what to do. And when you are going through when you're going through a crisis with a family member, the last thing you want to do is have different points of view to people, a caring circle of people who want to do what's best for this person. If you are starting to notice that, if you don't have advanced directives, have those difficult conversations. Another thing to take into consideration that you mentioned was they don't ask for help. My grandparents live in St. Mary's County, Point Lookout, literally at the end of the earth. Like if you drive to the end of Maryland, that's where my grandparents live. Because folks are, especially when there's a couple, they've probably been married for decades. They are a perfect yin yang. They balance each other. One's strengths or the other one's weaknesses. A lot of times there's fear of change. There's fear of control being taken away. So even though they might not be asking for help, you'll start to notice little cracks. And then as soon as one piece of that perfect balance that they have, they complete each other's sentences. One handles the housework, one handles the outside, the bills. Once a small part of that, their whole entire ecosystem will crumble really quickly. But I feel that a lot of times when there are couples who are more isolated, they won't ask for help because they're worried about losing that autonomy, losing that independence. And so letting them know now is the time to make your decisions. Now is the time to let us know what your wishes are, to be in control, and being clear and being open with us is not losing your independence. It's keeping your independence for as long as possible, because if they wait for a crisis, a lot of decisions will be made for them.
That's absolutely true, because my siblings and I ended up caregiving because of a crisis, and both my parents went into the emergency room on New Year's Day in 2015. And so it was crazy, and you really do need to be prepared, better prepared.
So many moves to hospital stays or crisis, obviously emergency room stays are crisis driven, and you don't want to be making a decision. You don't want to be looking for placement. You don't want to be shopping for care or home care aides, or you don't want to be interviewing people or doing any of that during a crisis.
Right.
Because a lot of decisions will be out of their control if you wait for that crisis to happen, out of everyone's control, your entire support group, your caregivers, as well as the individuals who need the care themselves. A lot of those decisions are taken away if you wait till a crisis. So really empowering them to be open, be honest, and make those decisions as clear as possible, as soon as possible.
I know, I'm not sure that we totally answered Judy's questions, but I do know that it was mentioned earlier that every county in the country has some type of resources. And so maybe calling that county's Department of Aging in Wilmington, Judy, to see what resources they have that can be helpful to you, even with you living so far away. Is there anyone else who wanted to comment on that?
I'll just say one thing too, that we always encourage. We do get a lot of long distance caregivers, what we call long distance caregivers, that we interact with. And we always kind of, to Jennifer's point with, getting in writing with the advanced directive, just getting everything in writing. We really encourage folks to start a notebook. So, if your dad's having some cognitive decline and your mom is the primary caregiver, if something happens with your mom, then having all of that information about your dad written down can help. Having those med lists written down, who are all of his doctors, who is, and just having all of that information written down, I think is a good first step for those long distance caregivers that feel like they don't really have that direct contact. Just starting to organize those sorts of things and just knowing this is where, where we keep our passwords. This is where we keep all this information, right? And just having that kind of stuff written down. And we encourage too, if your parents are open to it, if you can virtually join their doctor's appointments, we really encourage that too. That can help give you a little bit more insight into really what's going on. If they're not willing necessarily to ask for help, they may not be willing to maybe disclose some of the health things that are going on. So seeing if you can start opening up some of those doors too can give you a little more insight from a distance of what's actually going on. So.
And if I can add, in addition to advanced directives, they should have a durable power of attorney, because in this day and age, if your name isn't on the bank account, the bank isn't going to let you touch it, even if you're the daughter of the owner of the bank account, which means you're going to end up having to go to court and having yourself named as the guardian. And that costs money. And sometimes the court doesn't even make the adult child the guardian. So there's no guarantee that that person will be named. So it's something that we want families to avoid by planning ahead of time.
To
Okay.
a point that was made a little while ago, Megan responded, good point about the food desert, but I've never seen fruit that costs more than chicken.
Well, it's not about always the cost. Sometimes you just don't have access to fresh food, depending on where you live. So it's easier to buy a fried chicken sandwich than it is to get a salad, because it's just not as readily available to people.
Right.
Joan also had a statement, and she says, I'm sorry I arrived a little bit late. I may have missed this. Is there a research for home health care workers on an ad hoc basis? That is not through an agency. I'm looking for folks willing to work hourly without a regular or long-term commitment. I live in Kent County and imagine there are people interested in a gig work, and how do you connect with them?
That's a tough one, because no organization would be comfortable recommending someone who isn't licensed, because there are liability issues. I don't know. Do they have partners in care in Kent County?
I'm not aware of that.
Okay. But again, you might want to ask your Office on Aging, Upper Shore Aging, if they have any suggestions for how to find someone. But none of us would feel comfortable, even though you can go to the Alzheimer's Association Community Resource Finder. If you Google Community Resource Finder, you get drop-down menus on a variety of searchable topics, and home care is one of them. But in order to be listed, they would have to be licensed. They would have to exist legally in Maryland in order to show up on that list.
Okay, thank you.
So it's a word of mouth thing.
Right, that's about how I've been handling it, word of mouth.
But you still have to vet them very carefully.
Yeah.
I will say that even with companies, and I have to give a shout out to Home Instead. That's an excellent company that we used, but they got to be too expensive for us, and we had to go to a smaller company, and you get what you pay for. I'll just say that. So we have had several caregivers we had to fire. So
the thing is, you always hear stories from people about, oh, this woman was just so loving, and my mother, loved her, and blah, 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 and they have a relationship and they were friends, and you wonder, I want to find one of those people, somebody who's willing to work, because if you go through an agency, you have, they put their fee on top, and there's a minimum days a week, minimum hours per day. So, and I don't need that. I just need to be able to get away every once in a while, and have someone come in. But it's not on a regular basis.
There are like websites like Patch and Nextdoor where people might say, does anybody know a plumber? Or does anybody know a home care person? I'm not saying that's the right thing to do. I'm just saying it could be a resource for you.
Sure.
But you just have to be very careful and thoroughly check them out, and do a criminal background check.
Yeah, because for us, trust was the biggest thing when you have some stranger coming into your home.
Right.
A lot of times we stayed home and did work that we needed to do because there were certain home aides that came in that we didn't totally trust. They were
Right.
fine with my parents, but we didn't trust them in the house by themselves, you
Uh-huh.
know, so you really need to trust somebody before you leave them in your house.
Yeah.
I think
Yeah.
there's a lot of parallels between this and searching for childcare because
Yeah.
you're putting someone who you love more than anyone on the planet, who's vulnerable, who may not have communication skills, may not be able to report back to you what's going on when you're not there. I rely, Eileen had mentioned Patch or neighborhood lists. I rely very heavily on anything. My house was built in 1880, plumbers, roofer. Like I rely on my neighborhood mommies group. So finding a support group, finding a group of trusted people in your community, and obviously then doing the legwork after that, as Eileen said.
Yeah. Okay.
The background checks and it's difficult for sure.
We have a question from Bonita, and she says, I live in Prince George's County and brought my 87-year-old mom to live with me. She lived in Baltimore County. She has not been diagnosed with dementia or Alzheimer's, although she's experiencing cognitive decline. She forgets events, funerals, graduations, etc. She doesn't keep track of the days. She forgets that she's eaten. She does know who her grandchildren and great-grandchildren are. I don't know where to start to secure a diagnosis, to learn what services she's eligible for, etc. Where does she
Well,
start?
I would suggest that they call the helpline 800-272-3900, ask for a list of specialists if their primary care physician is not in a position to do cognitive testing and additional test imaging if it suggests that that should be the case. They can give them a list of specialists. And I would suggest, even if someone is newly diagnosed, they can call and schedule a care consultation with one of the clinicians, which is really helpful because so often the last thing the doctor says when they do give a diagnosis is, see you next year. And the family doesn't know what they should be doing next or where to put their foot down. And they don't have any, and the landscape of services is very complicated. And so they could do a care consultation at no cost, and they could help them with short-term planning, long-term planning. They could give them a to-do list of things that they, legal planning, and then begin helping them understand the local landscape, what's available through your local office on aging. Are you or your husband a veteran? If so, we want you to know that there's a veteran aid and attendance program that could be helpful at some point. And so they are really experts on resources and have lists. So I would definitely suggest that, both to find a specialist, someone to make the diagnosis, as well as to begin planning if there is a diagnosis made.
Are there any other questions or comments? Caitlin, that was the last one in the chat box.
Okay.
Oh, and
All
then
right.
she's asking, Eileen, can you confirm your email?
There was a typo
It's in the
there.
chat.
Oh, my
believe.
fault. I'm sorry.
There's a typo. I'm going to put it in.
Judy,
Okay.
thank you for noticing that. Anyway, any other questions?
There is another question in the chat. And I guess you can't see it, Diana, so I'm going to read it.
Please.
It says, I live in Prince George's County.
I just did that one.
She did that.
Oh, I'm sorry.
No problem.
Yeah.
Going back to me.
Thank you for the correction on that. Okay, Ellen, I'll turn it back to you because I think we're out of questions at the moment.
Sure. I'm going to ask each panelist to close it out with something that you can say that will give our women caregivers some hope. I'll start with you, Donita.
Breathe. I mean, to be honest, it's hard, especially in this climate that we're in. Um, so I would say take deep breaths whenever you can and give yourself grace. Um, for the caregivers, you're doing the best that you can, and just try to stay positive. Smile. Smiling helps. It brings good energy, and breathe and move and raise your endorphins. Like, do those are the only things you can do, because you know, to be honest, Caitlin, this is a hard time for everyone. So, but I would say do those things, and most of all, be selfful. Don't feel guilty when it's time to do you, and don't be reckless in being selfless and caring for the person that you're caring for. Be selfful.
Okay. Nicole?
I would say look around at the community that you guys have. You know, everyone that showed up here tonight and all the communities that everyone mentioned that are out there, like Benti Circle and Keswick and all these amazing communities, and really lean into that support and just know that you're certainly not alone. If we just look on this Zoom right here, we can see that all of us are not alone. And so really lean into the community that you have, and build a community. If you don't have one there that you have right now, you can build one. So use your
Absolutely.
community.
That's what Donita did when she
That's
realized
right.
she didn't have it. So, Jennifer.
Yes. I'm going to go back to my oxygen mask. I think that that's a really great visual. I think it's difficult for people to wrap their minds around because it's counterintuitive. But so much of caregiving, and so much specifically of dementia care, is counterintuitive. Donita had a great point about grace. Giving yourself grace and giving yourself a chance to catch your breath. Sit in the car, like Kaylin mentioned. Sit in the car, catch your breath. Give yourself grace, and remember that you can't pour from an empty cup. Caregiving is emotionally, mentally, physically, spiritually exhausting. And you truly, truly are doing everyone in your life a disservice when you don't take care of yourself. So remember that you can't pour from an empty cup. Remember that you have to put your oxygen on first. Breathe and give yourself grace. And I also really like Donita's respite spots. And it can be anywhere. It can be the bathroom. It can be your car. But give yourself the grace and the time that you need so that you can be there to support your loved one. You guys got this.
Eileen.
You're not alone.
Eileen?
Yeah, I agree with everything that the other panelists said, but also say that caregivers, do your homework, learn as much as you can, learn about your local landscape of services, support groups, know your local office on aging, get to know your local senior center. They may have programs, early stage programs for people who are caring for loved ones with dementia. Just learn that landscape and don't be afraid to ask for help. Because when you do engage with other people, it just makes the journey much more bearable, because you realize you're not alone and you're not the only one. Because, I was a caregiver for my mom who passed at 105 last year. And the first 100
That's
years
amazing.
were great, but the last 5 were really rough when she had mobility problems. And she didn't have dementia, but she was not easy sometimes. And today I can smile and think fondly and laugh. I could probably do a stand-up comedy routine about her because she really was funny. Last 5 years were rough. And so I know what y'all go through. I know what caregivers go through, whether it's dementia or not dementia. It's not an easy job, but you got to learn and take advantage and ask for help.
Absolutely. And I'll add that, as someone who is no longer a caregiver, once your loved one passes, if you're in some type of support group, don't leave it. One thing that I love about the Benti Circle is that it allows those of us whose parents have passed to stay in the organization. And I still need that support. It has helped me through my grief. And it is helping me to figure out, what am I doing with my life now? You know, once you stop becoming a caregiver, a lot of times you're like, what do I do now? And so that has been great for me. Before we close out, I want to throw it to our board vice president, Donita, so that she can tell you about our upcoming program on Saturday.
Good evening, everyone, and thank you so much, Kaylin, for having this program. Whether you're dealing with dementia or, as Eileen said, just an aging parent, this has been uplifting and gave great resources. On this Saturday at 11 o'clock, the Maryland Women Heritage Center is going to be partnering with a group called White Women Who Show Up. And what we are trying to accomplish through these Zoom meetings that we're having, this is our 7th Zoom meeting, I'm very proud of that, is to create allyship and communication through and amongst all women, across all races, all ages, all backgrounds, with the purpose of creating allyship, solidarity, especially now during these times when the norm is being challenged, and when in so many cases women are losing their rights. And this Saturday, Judy Carbone, who is a member of the Maryland Commission for Women, she will be our speaker, and she is going to be talking about what the Maryland Commission for Women does, and she's also going to be sharing her own journey. She's an activist. She's out there fighting the fight for many causes and for women. I think it's going to be an extremely interesting and exciting talk, and I invite you all to go on to Eventbrite and look for allyship, finding commonalities, the conversation number 7, and register to join us at 11 o'clock on Saturday. Thank you, Kayla.
Absolutely. And it is free. And if you go on the Maryland Women's Heritage Center Facebook page, the direct link to the registration is there as well.
Pam, if I
I
can add
wanna-
a couple comments or questions.
Yes, absolutely.
Joan asked, and if Donita, would you add in the chat box your organization's website? I know I put your email in, but if you could put your website in the chat box if possible. Or you can, Joan, you can just email her directly. Her address is at the at the
great.
top of the chat.
Oh, great.
And
Thank
we
you.
also,
Thank
and we
you.
also had a comment from Judy Carbone from Western Maryland, which you always think of Western Maryland as Mountain Maryland, but they may or may not have the same kind of resources that we have in Central Maryland. So Judy's doing a lot of stuff on her own in many different areas related to women. But her comment is, so many great tips and such good advice. I especially appreciate Nicole's suggestion of a notebook, which I'm going to do the next time I travel to see my folks. Thank you, everyone. Thank you for all you do to support caregivers and let them know that they are not alone. Be well.
Absolutely. Thank you, Judy. And we look forward to hearing you talk about your activism on Saturday. So thank you so much to our panelists. Again, we want to thank Donita Brown. We want to thank Nicole, DeGilio, Jennifer Fenton, and Eileen Rosenthal. They gave us a wealth of information and gave us some hope. For those of you who are still caregiving, they gave you what I had hoped for, which was research, resources, and respite. So I am very thankful to have had this conversation. We did it last year and it was popular, and I wanted to do it again this year for National Family Caregivers Month because there are so many more caregivers out there who are looking for help. So thank you so much for joining me for this conversation. And we hope to see you at our next event.
Do you
And
want
have
to
a
turn
great
it over
night,
to
everybody.
Kaylin, please, for Kate's closing?
Oh, Kate, I'm sorry. I thought Donita was doing it. Okay, go ahead.
Well, everyone has said so many amazing suggestions for helping us through this specific stage of our life. And I thank you. And I thank the people who attended tonight. I hope you received some of the information you were looking for. And we are at recording this event. So you can, we will make sure you have the connection to access this recording. I think there's plenty of information to process. And again, thank you to our speakers and to Kaylin for putting this all together. It's women helping women and educating and helping each other. And it is with gratitude that we feel with all of you being here tonight. So thank you and good night.
Thank you.
Good night, everybody.
Good night.
Night.
Good
Thank
night,
you.
folks. Have a wonderful night.
Thank you.
Hi, Joan.
Hi, Kate.
Oops, I'm sorry you're going through all of what, oh, Joan got off. Okay. She's a friend of mine. I didn't know she was going through such difficult challenges. So, okay.
Normally we would debrief, but we didn't talk about that ahead of time. So everybody's gone and it's 8 o'clock. So
Yeah.
I'll get with Kaylin tomorrow. I think it went really, oh, recording, stop. Sorry. Stop.